Hi, it is December 2nd as I'm recording this. It's on Monday, so it will be released on the first Monday on the month. Today we're talking about cancer, creativity, and everything in between, especially hope. Today the subject is hope. And let's be real, hope isn't always pretty, smiling, and perfect. Sometimes hope is raw. It's in the writing we create, the words we read, and even the distractions we choose. Sometimes hope is being the helper or being helped. Sometimes it's just being. And hope has been with me in small and big ways throughout those treatments. And it was there in moments of crying in the shower when I was singing Cancer, Cancer, Go Away. It was there researching endlessly or smiling at the tiniest joys in being present. And sometimes it was just about knowing that shitty moments are just that, shitty moments. Because hope doesn't stop the anger or the frustration. It's not about hiding. Hope is about really, it's about daring to want something for yourself, for others, or just hoping for that one moment, the one that's not shitty. And sometimes it's just thinking about what might be 5 minutes from now, or even just 5 seconds from now. And here again, I want to be clear because it's not, as I said, hope is also not all pretty and smiling and everything, but it's also not something that sometimes I attained by myself. I had help. I had help from people around me. I had help from therapy because sometimes hope felt, it's not about hiding, but sometimes it felt like it was playing hide and seek. And therapy has helped me by giving me tools to find those small moments of light where everything just felt super dark. Let's rewind back to December 2017, talking about dark moments and also moments of lights. In December 2017, I got more crappy news. I was waiting to tell everyone about what I had been going through by getting good news. I thought, okay, I'm going to share the fact that I had been diagnosed with Hodgkin's lymphoma, but that my first scan was great. Everything was on up and up. I got my scan results. I think I got them on maybe the 15th of December. And it said that it did not say no evidence of disease. So that's for people who have Hodgkin's lymphoma. There is this idea that you're going to get your first mid-cycle scan and it's going to show no evidence of disease. And basically you're continuing chemo, but it's just to make sure that everything, even the microscopic things that are not seen on the scan, are totally gone. And then you're good to go. I mean, yes, it's hard. Chemo is still very difficult. You had cancer, which is something you will probably have to deal with. Also on an emotional and psychological level, and also on a physical level, because chemo does have side effects. And so I'm not trying to minimize the experience that people have, even if they have the scan that shows no evidence of disease, because that's still difficult. That's still hard. My scan didn't bring those news that I still would consider good news. Instead, it showed that I was still lighting up in several areas, still a party in my PET scan. My doctors then told me that the disease was now primary refractory Hodgkin's, meaning that it was harder to treat. I would have to check when I actually joined Facebook groups. I had not joined Facebook groups at the beginning, but then I joined the refractory Hodgkin's lymphoma group, and that group has been very, very, very helpful. I think I got the first news that the scan was not no evidence of disease. I was sitting on this couch, and I think my parents were sitting at the table behind me, and I remember feeling my heart drop. My oncologist, I will call him my fellow oncologist because he was a fellow. He was not my fellow. I'm not an oncologist, but he was a fellow. So my oncologist fellow, I don't know how that works, but he's the one who called me. He was the one who I had seen the most of during my visits. He was the one I was communicating the most with, but he was also, as I said, a fellow. So there was another oncologist on my team who was established already. But the one who called me to let me know was my oncologist fellow. And when I had my appointment afterwards, it was with, actually, maybe I got it after I'm trying to remember when I had the results. I thought I was here, but no, I think I was actually at Johns Hopkins, and we were leaving because I had also a pulmonary test function. And I think that, yeah, I think I had those results maybe when I was walking back with the chemical engineer to the parking lot, and he called me to let me know the news. Maybe that's then. Because I remember there was a moment there, here and there too, where I asked him, does that mean I'm going to have to do a stem cell transplant, an autologous stem cell transplant? And he said, yes, most probably. And I remember crying because I was super scared of doing a stem cell transplant, which I ended up doing, but I didn't do it here and there. I didn't do it in 2017. I did it in 2019. And my body was much stronger when I went through it. In 2017, I was still pretty weak, and I still had sometimes issues walking, and my pulmonary lung function was not the best. I also had those results. It got better, but it still was not what is considered normal, I think. Where I got the news is not the main point of this podcast episode, but I do remember afterwards I actually went through my notes, or my doctor's notes, on my portfolio, and I had my follow-up visit with both the fellow and the main oncologist, or the lead doctor on my case, on December 20th. And that visit, it was a tough one. It left me felt unheard, lost, and hope was not, I don't think I even thought about the word during that visit. And it wasn't the fellow, the fellow we had was wonderful. We even asked him at some point after we had met with the lead oncologist, we asked the fellow what he would do if it was his sister or somebody who was in my position. And he said he would get a second opinion. The lead doctor made it seem like getting a second opinion, which we were planning to do at the University of Maryland and at Memorial Sloan Kettering. So we were actually going to get a second and a third opinion. Well, he made it seem that going to the University of Maryland was pointless. In Maryland, both Johns Hopkins and the University of Maryland are NCI-designated cancer centers, so National Cancer Institute designated cancer center. Interestingly enough, when I read his notes, which I don't think I've ever read until now, he mentions NIH instead of the University of Maryland. And I think I did mention NIH there because I was wondering if they had, if there was anything that maybe we could go see somebody at NIH. Maybe there was a clinical trial we could try there, or a lot of different things. And we were talking about treatment options. And we mentioned that a German protocol, that's what it was called because it was invented in Germany, if that maybe would be a possibility based on those results that I had. And he flat out said no, said he would never do that. He had very strong feelings about it. Very, very strong feelings about that protocol. And then he also gave himself props to doing a scan after 2 cycles instead of 3 cycles, even though I read sometimes you could do 2 or 3 cycles depending on how the patients felt. And clearly I was still having issues. So it's not like I was suddenly doing much better and walking without any problems ever and not feeling dizzy and all those things. What was funny though, what really made me laugh when I read his notes, is that the first line of his notes, and I quote, and I will redact the name of the fellow. I will just say a total of 40 minutes in the presence of fellow doctor and her significant other. The fact that he put a total of 40 minutes, I don't know, it makes me feel like maybe he didn't want to spend all that time with us, but also I don't have a great experience with the man. So I mean, I may come at it from that experience as well. And the third line was, the patient and her significant other are quite knowledgeable in searching the web and other sources of our data, and because of their readings, hold strong opinions on treatment options. Reading that now, I'm like, okay, maybe I was stubborn during that discussion, but so was he. And the thing is, I felt, maybe he didn't, but I totally felt dismissed by him throughout this entire discussion. I still agreed to consider the clinical trial he suggested, but he was talking about not doing an autologous stem cell. He wanted me to do an allo or allo, which is basically, long story short, but it would be with the donor, and an aplo would most likely be with somebody from your family because you need to share. Anyhow, he was trying to find a way to get me to either partial remission or complete remission, and then if it was partial remission, to go to allo, so with a donor, which is harder on the body than an autologous stem cell transplant. The reason why I'm also have all those feelings right now is this was the man who told me word for word that I was now interesting because of those PET scan results. That's what he said to me. He said, now you're interesting. Like, that's not what you want to hear as a cancer patient. Also, you don't want to hear that now you're interesting. You should be interesting from the get-go. I don't know. He should not be just looking at you because now he might be able to have you in one of his clinical trials. It should not be that before that, if he's treating patients who have Hodgkin's lymphoma, I understand that this is not a like they are way, and I don't want to put them on a scale of good and worse, but they are cancers that are more, the statistics are just worse than for Hodgkin's lymphoma. Yet at the same time, you do have patients who have refractory Hodgkin's lymphoma. You have patients whose Hodgkin's lymphoma comes back, and you also have patients who still are people, even if they do not become refractory or relapsed or. The people who had only, like, and I say only, I should not say only, who have 3 months of chemo should not be treated like, oh yeah, you're just fine. Like, basically, why do you even have an opinion or voice an opinion or have feelings about everything you're going through? Because you're entitled to those feelings. You can work through those feelings. I have feelings talking about those feelings. Yeah, he really pissed me off. And also, let's not forget the time that I dared question whether a PICC line, so I did not have a port during my first 2 months of treatments, and then they wanted, because my veins were so bad, they wanted to put a PICC line, which is basically, it's external, it goes into your vein in your arms, and then, anyhow, I asked if it was possible for them to do that, knowing that my tumor was pressing against the vein that it was supposed to go into. And he ignored me. He basically was like, yeah, it's fine. Like, basically, why you have even asking questions? We do that all the time. You're not special. I guess I was not interesting at that time, so why listen to me? And when the nurse tried, it was incredibly painful. I was by myself. Usually my husband went with me to wherever he could go, he would go. My parents were with me also at the time, but everybody had to stay in the waiting area, and I went by myself with the nurse, who also had Hodgkin's herself. She was, I think, in her 50s or 60s. She was very kind, and when she noticed how A, painful it was, and B, my heart started racing because she was trying to push it into the place where I said, maybe it's not going to work, because didn't they say it was compressed a little bit? And he was like, yeah, fine. Well, my heart started racing, and again, it was painful. And she promised me that she actually told me, she was like, I will never agree to do that to you again. Like, we will not do this. You need to tell them if they want you to have a PICC line, they need to have intervention radiology with doing this, because I am not putting you through this again. This is not right. And it was not right. And it was not right because that could have been also avoided. So when my husband and I told that to the main oncologist guy, he smiled, threw his hands up, and left the room. Like, as if that was just a big joke, as if I was not the one who had to go through the freaking thing. Like, it's ridiculous. And I think that's when I started reading more anyway, because when you have that impression that the person who is supposed to treat you is not considering you, like, first of all, it doesn't feel right. And then it doesn't really inspire a lot of trust. And so, yes, I became more acquainted with research, and not just WebMD, but research papers from known sources, from experts in the field, from conferences. I started reading more and more papers and things that were in the pipeline. Like I wanted to know what was available in clinical trials. I wanted to know what were the latest protocols that had been developed, what were people looking at. I was just getting more and more involved into my care because, again, that was, I even then they tried to put a port on me in December, and I asked, so before the scan, and I asked, well, how is that going to work? Because we don't know, if the mass is still there. How is that, like, am I allowed to be fully asleep? Am I allowed to be laying down for this particular procedure completely? And the anesthesia, like, everything was supposed to be fine. And then we got there at 5:30 in the morning for the procedure. I got hooked up to everything until we actually talked to the anesthetist. I can't remember how it's called. And they decided, after talking with us, like, well, actually, no, we're not going to do that. Like, we're not going to put on the port today. So when you're going through treatment and you're already tired and you're already kind of scared and you're already frustrated and you're still having all those physical symptoms in addition. And I think I was depressed at the time. It was hard. It was just not, I didn't know how to deal with it. I mean, looking back, yes, there was also probably OCD going on, but I think there was also a bit of depression going on. I didn't have any, it's a comprehensive cancer center. The comprehensive is because you're supposed to take care of more than the body. You're supposed to take care of everything. And I didn't have that extra help. All of that was not, that was not in the notes that I took for this episode, but I clearly needed to get it out here. Going back, I was reading a lot of things. And again, I'm not a doctor, but I needed to understand my options. And I needed to be an active participant in my care. At the same time, I leaned on distractions. I watched a lot of TV shows and movies. I spent time with my parents doing puzzles, watching HGTV. We traveled through the TV, and I started thinking about reading again. And when I looked back at my online orders from that time, like around December, I noticed ordering more romance novels, which I was already reading, but I think in October, November, I was not reading a whole lot. And I think December is when I started trying to read again. And it felt like a small step, but those books, and again, later on, definitely in 2018 and 2019, I started reading and reading and reading and reading. Again, something that I've done all my life. I've read a lot all my life, but there are certain periods where maybe I was working more and maybe I didn't have, when I was taking the train, when I was commuting to work, I was clearly reading a lot in the train. And sometimes maybe I would read a little bit less, but then it started being an escape because, it's hope that you can hold on to when you're reading too. Do you like how I'm doing the segue for hope? At the time, I had already contacted the University of Maryland. I remember calling them crying, scared, overwhelmed, everything. And the woman on the phone, she not only comforted me, but she also managed to get me an earlier appointment. And actually, I remember her telling me, like, oh, and it's great because that earlier appointment is with Dr. Rappaport. And she sounded very happy that I was going to have an appointment with Dr. Rappaport. She told me he was wonderful and explained he's the director of the blood and marrow transplant program. And again, because transplant kind of seemed inevitable at the time, it felt like the right move. When I met Dr. Rappaport, it was like night and day compared to my previous experience. He wasn't all doom and gloom. He listened. He told me about their social worker who could help with my anxiety. He told me about imagery, like things you could use to also help with that. Basically, he put the comprehensive in Comprehensive Cancer Center. And the University of Maryland made sure to let me know everything I had available to me. They had a patient, like a survivor patient coordinator, because you become a survivor as soon as you are. Like as soon as you're diagnosed with cancer, you are a survivor. That's how they look at it. Yeah, they had somebody who would basically be a contact person where I could also talk to if I needed more help, if I needed to know more about, they also do acupuncture. They were offering different things that could be helpful for stress and for well-being. And again, a social worker that you could see first, a psychiatric who would then refer you to that social worker if she thinks that could be helpful, and then you could have therapy. I needed therapy. I was clearly not doing well. I was trying, and I think, I was doing better, with my parents, with my husband being there, but those years were hard, and it was difficult for me at that time. I did not really know how to handle a lot of different things, and having that support sounded good. And then my mind was like, he looked at the scan and he was not like, oh yes, this is awful. What I had heard less than a week prior, or maybe a week prior, because I think I had my appointment on December 28th. So 8 days prior, I had heard how awful everything was from that scan, that it did not really show anything. Actually, it's a note also in that oncologist from Johns Hopkins where he had written that he had explained to me that that small decline in SUV and size of the tumor, was negligible. It did not mean anything. And here I had another oncologist who was looking at the exact same scans and was telling me, well, okay, yes, it could be better. Like that's not what we want, but it's also not awful. And not hearing that it's not awful was good. I mean, he said, he was like, yeah, okay, it's reduced. We could continue the same treatments, or you could add brentuximab, and so a different drug. So you would replace one of the drugs with that particular one, which is supposed to target the cells of Hodgkin's lymphoma, and we can try that, and that could be an option. And I can make sure with the insurance that it's to make sure that it's covered. And we would start like as soon as possible, because now you haven't had any chemo since blah blah blah. Because I was about to maybe join a trial, I could not have chemo for like a certain amount of weeks before joining that trial. And so Dr. Rappaport was like, okay, well, we could do this. He was not pushing a transplant. He actually told me transplant would be an option, but it's not necessarily the only option, because if you reach complete remission on that particular treatment, then we do not need to do, like, we don't necessarily need to consolidate with a transplant. We might want to consolidate with a transplant, but it's not necessarily a must. So he was the director of blood and marrow transplant, and yet he was not pushing that as the sole solution. And I'm not saying it's like when you go to buy a car, because that's not the same, but he was not being all salesman about his work, which I really appreciated. Especially because at that moment, I mentioned I was not in the best physical shape. That was one thing that was really worrying to me. It's like, what if I go into all of that and my body is not yet ready for it? That was freaking me out. And knowing there were more options, it was priceless. So hope showed up in so many places after that second opinion. It showed up in therapy. I got therapy, and it really helped. It showed up in organizing an online auction to benefit young adults with cancer, in writing Trust Me Not later as a way to work through my emotions, and then even later writing The Leftover Bride to make me smile. I was still going through treatment, or the aftermath of treatment, when I wrote those books. It came in reading even more romance novels, in grocery store trips with my parents, in a dinner in New York City during those uncertain moments where I was going for my third opinion. Because again, December was not an easy time. We went to New York at the beginning of January 2018. So I had gotten that second opinion on December 28th, and we celebrated New Year's Eve at home, which was complicated. It was hard. And because, again, we were a little bit of the unknown. I didn't know what I was going to do. I didn't have chemo for a bit. And that also was scary, because I was worried, like, what is my body doing during that time? Still trying to enjoy, the small moments, and trying to hope for the 5 seconds after that, or the 5 minutes after that, or in that case, for that trip to New York. And we actually did enjoy that trip in New York at the beginning of January. And I'll tell you more about that in next episode. Gratitude is basically, it lets you see the good moments, right? But hope helped me look for those moments, even when sometimes they felt like, as I said, they were playing hide and seek. I've mentioned at the beginning of the episode, hope does not erase the struggle. It's basically that little thing that helps us move forward, I feel like, even when stuff feels crushing and overwhelming. January episode, I'll share more about my visit to Memorial Sloan Kettering, which was basically my third opinion, and how that visit really helped me in deciding what was going to be my next step, where I was gonna, and actually helped me decide to transfer my care to the University of Maryland, and how I began finding my voice. And I think I'll share more about hope, because that has been a part of everything and it deserves the time. I really, really hope those episodes are helpful and hopeful, maybe a little. Don't hesitate to ask me a question. You can go on my website, www.authorelodienowodazkij.com. If you do not know how to spell Nowodatsky, don't worry. It's also www.d-as-dog.net, and then you will be redirected to my website. And you can also send me an email at authorelodienowodazkij@gmail.com. So for that, Nowodatsky is Nowod as dog Azkij. I have the email in the episode's description. I also have the website in the episode description. Please don't hesitate to subscribe, leave a comment. To all writers out there, happy writing, and to everyone, happy reading, and wishing you a lot of hope.